Hello, welcome to another one of our Dr. Foot videos. In this video, I'm going to be talking about a condition which I'm seeing an awful lot of recently, and that is gout. I'm seeing an awful lot of patients with gout at the moment. Let me explain what gout is, and let me explain how you can get gout and what you can do about it to prevent it and how you can treat it. So, gout is a form of inflammatory arthritis. It occurs when too much uric acid is built up in the bloodstream, and that gets deposited into joints, and you get a lot of uric acid crystals. The foot gets swollen. It can happen in a lot of different joints. It commonly occurs in the first metatarsophalangeal joint, the big toe. I see a lot of it in that joint. It can be very red, swollen. You can hardly put your foot on the floor. It's that painful. It will stop you in your tracks. It can get really hot. It can also occur in the second toe. That's particularly bad. It can occur in the ankles. So I've seen it on the outside of the ankle sometimes, and it can occur in knees. But I primarily see it in the first metatarsophalangeal joint, the big toe. Now, gout is a condition which occurs primarily in men, and primarily with men that are living at large. People that like their food, like their alcohol, like a bit of Jack Daniels. But you can get this even if you're not a drinker. So even if you don't drink alcohol, because of other lifestyle issues or because of a pre-existing health condition. So too much uric acid gets built up in the body, and the kidneys have to filter this uric acid. I'll put up an animation to show you. If the kidneys are unable to filter this because you are either a diabetic or you're on certain medication, for example, high blood pressure medication, or you have another existing health condition, then excessive uric acid will build up within your kidneys, and that can cause a gouty attack. Or you're consuming too much uric acid and too many foods and drinks that can lead to an excess in uric acid, and then it builds up. At this stage, this forms into crystals and they get deposited into joints, and it causes an inflammatory reaction, inflammatory arthritis almost. So, apart from the medication and pre-existing health conditions, how else can you get it? Well, lifestyle factors. First of all, purine, which is in red meat. If you're eating a lot of red meat, then you are at a higher risk of developing gout. If you are consuming a lot of beer, alcohol and beer, then you're also at a higher risk. If you're having a lot of sugary drinks. Now, I know people that can down 4 or 5 cans of Coke, and then they come to me and say, I don't drink alcohol and I don't have red meat. Why have I got it? Well, you're drinking a lot of Coke. That's the reason why you got it. It can be a contributing factor. Junk food. Junk food. Where do I start with junk food? Okay, so I understand that in this day and age, it's hard to eat healthy. Really hard to eat healthy. So if you're consuming junk food every day, then you're at a higher risk of developing conditions like gout. I always tell my patients, if you're going to have junk food, then make it a cheat meal once a week. You should see my cheat meal. I go for it. But it's once a week, so I tend to enjoy it. If I'm eating it every day, then obviously I'm going to have problems that can occur. Certain studies have found that yeast and bread can be a contributing factor. Certain fruits like prunes and peaches can also be a contributing factor to developing gout. Others have found that oats can also be a contributing factor, so they've said to reduce the amount of oats you're consuming. Salty foods can also be a contributing factor if you're consuming too much. And it's like anything, moderation. Let me just have a little bit of coffee. I think coffee's alright. Drink as much coffee as you like. I don't think you'll get gout. Hope you don't get gout. Finally, processed food. Now, processed food can lead to a gouty attack. Too much processed food. If you're not eating enough fresh fruit and vegetables and food that's cooked rather than just out of a packet can lead to a gouty attack. So what do we do? Well, first of all, either myself will take a blood test, and I do blood tests all the time. I send off for the bloods and I find out how high your uric acid levels are, or your GP will do it. One way or the other, we need a positive diagnosis. To be fair, it's usually we can tell in clinic. However, sometimes rheumatoid arthritis or sometimes injuries can look like a gouty attack. So it's better to be safe than sorry and just get a blood test. It doesn't take long at all. Once we have a positive diagnosis, I also do an ultrasound scan. So usually on ultrasound, gouty inflammation looks different to a normal injury. Once I have a positive diagnosis, then I will always talk about all those things I talked about with diet, lifestyle, exercise, losing weight, all of that, and how much alcohol you consume and what other foods you're consuming. To reduce the inflammation, the doctor can put you on certain types of short-term steroids or long-term steroids, or a podiatrist who is an independent prescriber. I'm not one yet, but I'm hoping in the next year or so to become an independent prescriber. That will enable myself to be able to take care of my patients without them having to go to their GP, hopefully. What I tend to do is I do a lot of injections into the big toe for gout. So the first thing I do is actually put the needle in and I aspirate. I take out the buildup that we have of uric acid crystals within that joint. After I've done that, I inject some corticosteroid to reduce the inflammation. It's an effective treatment option, but you can't keep having this done. So I can get somebody back on their feet, but if you're constantly having gouty attacks, then you need to change your lifestyle, not just have injections every time they hurt. I hope you found this helpful. I hope I haven't missed anything out. It's such a large, vast topic, and a short video really doesn't do it justice. But I hope you found this interesting. If you are overweight, you know you're overweight, especially if you're male, you know you're overweight. If you get to a certain age, above 40, and you know that you're overweight and you're eating a lot of processed meat, red meat, and you're going heavy on the drink, you are gonna get, well, not say you are definitely gonna get gout, but you're at a higher risk of getting gout. So, as with everything else, take care of your body and your body will take care of you. Hope you enjoyed this video and I shall speak to you soon. Goodbye.